Now that it's Thursday out of the 8:30 news, we're into What's Up Doc, where we get to spend some time with the experts in healthcare with Mercy Health. We learn lots of things, and as we pointed out time and time again, they learn not to volunteer for interviews.
Right, it's the last time they'll do that.
Yep, everybody walks away from this having learned something. And this morning, the guy who will be teaching us a few things is Dr. David Shoberg. Dr. Shoberg, good morning to you.
Good morning. How you guys doing?
We're great. How's everything going with you?
Everything's good.
Tell us about you.
Well, pediatric pulmonology, I've been practicing here in Rockford for over 20 years and take care of kids all the way from infants up to college age with lung problems. So been working here for a long time and seen a lot of kids over the years.
What got you your start in medicine? You from a little kid on, or all of a sudden it dawned on you later on? When did you decide, hey, medicine's the thing for me?
I started thinking about college. But I'd never even heard of what a pediatric pulmonologist was, so I had no clue what that was. I just got interested in pediatrics when I was in medical school, and then decided to subspecialize in pulmonary. So spent all those years in undergrad, medical school, then 3 years in residency in general pediatrics, then another 3 years in fellowship training in pulmonology for kids.
You want to give them the college quiz
I
here?
was about to. And where did we matriculate?
Oh, well, I went to North Park University down in Chicago.
Oh, yeah.
And then went on to University of Illinois in Chicago for medical school. Nice. Then went to Lutheran General for general pediatrics out in Park Ridge. And then went to Indiana University down in Indianapolis for pulmonology, pulmonology critical care. So did 3 years doing that. And then came right up here. Started the first place I worked was in Rockford, and I've been here ever since. So,
you grow up around the area?
No, suburbs of Chicago, like Mount Prospect and Arlington Heights area.
Yeah. So, how'd you land? Did they had the right job, or it was in an attractive area for you?
It was, I have family in the Chicago suburbs still, so it was still close enough to that. But there were some opportunities out here at the time. Both at the time it was Rockford Memorial and Swedish American were the two main players in town, and they were both looking for people. And I started at Rockford Health Systems, and been here pretty much ever since.
Outstanding. Now, you mentioned going in not knowing what pediatric pulmonology was. You gave us a little bit of a clue as to what it was at the beginning here, but can you expand a little bit further?
Sure. Pulmonology, interesting in pediatrics, kind of grew out of cystic fibrosis care. So most of the original pulmonologists that were trained for pediatrics were to take care of kids with cystic fibrosis. And out of that, pretty much those first pulmonologists, they also took over anything else that was respiratory related, because cystic fibrosis is primarily a respiratory problem, but it also involves the GI tract, and it's a multi-system issue. But so the initial people really started with cystic fibrosis, and then it grew into asthma and all the premature kids that have chronic lung disease. We take care of a lot of that, and kids with airway problems and pneumonias and respiratory failure for whatever reason, and so it's just. And a lot of those kids have chronic problems. Those are problems that may start when they're infants, but they'll continue to have problems, up, through adulthood, some through their entire life. So it's more of a chronic type practice because you're dealing with kids over a very long period of time.
It's fascinating because when you think about lung health and stuff, I mean, smoking is obviously the number one thing that we think about with lung health. You probably don't have too many patients that have a pack-a-day habit quite yet. But is it all chronic? Is all your patients you're dealing with something they're born with, or is there a lung problem that can develop in a young person's life?
Oh, sure. I mean, not everybody is born with respiratory problems. I mean, a lot of people will develop asthma symptoms later on in life, even into adulthood. And you're right. Environmental exposure to certain things plays a huge role. I mean, we don't see as many kids smoking like we used to in the past. It's not as common. But then, the whole vaping issue came up, and that posed some issues. And obviously, they weren't born with that. So, So you have environmental exposures that are always going to play a role. Anything in the anything in the air that you can smell and see, I mean, that you can inhale into your lungs, and that can cause issues. So And with all the viral infections, too. Those things are things that come up. And sometimes you have people that don't have issues or have very mild issues, and then they get the wrong virus, and all of a sudden it brings out those problems they maybe never had before, all of a sudden evident now after they get sick with something.
Doctor, speaking from the angle of a guy who's in his 50s, as I am, I remember being back as a kid in school. One of the things that there's a couple of things you hear about a lot today that we did not hear about when we were in school. One of those is the peanut allergies. I mean, right. Peanut butter was as ubiquitous as anything. I mean, it was just everywhere, and everybody had it. And I never knew of any kid that I ever went to school with having any sort of difficulty with peanuts. You hear about all that today. Another thing that you hear a lot about today that as a kid I didn't hear about, I don't ever remember having a friend who complained of having it, is asthma. Is right. It because we didn't know much about it? It was just as prevalent then as it is now, or are we seeing more of it now than we did then?
No, that's a little bit of it, but more of it is that we are seeing more of these, both of those problems, allergy problems and asthma and allergy go hand in hand. So we're definitely seeing a rise in that over the years. I mean, I'm like you. I didn't know kids that had peanut allergies like what you're seeing now,
nope.
Nor asthma like we see now. So, I mean, those things have been on the rise steadily over the years. There's some theories behind what the cause of it is. It's not really clear that we really know for certain why we're seeing such a rise in this. There's talk about the cleanliness theory, and they're not exposed to enough irritants and whatnot early on. But, let's speculate on what that is. But we clearly have seen a steady rise over the years, and it's a much bigger problem than it ever used to be.
What is the number one or the majority of the ailments that you see kids for?
Asthma, by far.
Really?
Asthma is by far the number one thing we see, and across the spectrum. It's funny. I mean, a lot of kids will have asthma-like symptoms in those first few years of life. Not all of those kids go on to have asthma. So you have kids that have just viral-induced wheezing where the viruses cause them to wheeze, but asthma causes wheezing too. So early on in those first few years, I'm talking preschool years, I mean, the symptoms are very similar, but you'll find that over those years, the kids with just viral-induced wheezing, where viruses are just causing it, they'll kind of grow out of it. That will resolve by the time they're going away to kindergarten. Whereas like an asthmatic, those symptoms are going to persist well beyond that into school age and beyond. And especially if you're seeing underlying allergies pop up early in the first few years, those are the kids more likely to have asthma. So early on, when you're hearing the wheezing and cough, chest congestion, the colds that kind of go into the chest and settle in the chest in the kids, not all those kids are going to have asthma. A lot of them are just going to have those problems induced by viruses, and they will outgrow that. But the asthmatics will persist. And then you've got to follow them, and then things change as they get older. Again, a lot of it depends on environment and exposure, ongoing exposure to various irritants. If you've got allergies and you've got an allergen in the house that's there all the time, that's going to be an ongoing exposure, and those kids tend to have more symptoms and maybe a little bit harder to manage.
One of the things that dawned on me is when we had moved into a new house, and one of the neighbors had stopped over, to greet and welcome to the neighborhood and all that, and then asked me the oddest question, which was, we were moving in, it was 1st of August, so fall was coming, and the neighbor said to me, are you a leaf-burning family? And I said, well, I mean, I like the smell of it. Mm-hmm. I mean, I grew up, but not necessarily. Why do you ask that question? I mean, we've just met. Both my kids have asthma, and we've had people around who burn leaves. It becomes a nightmare in our household. I was just going to beg you to the point that I'll even come over and rake your leaves myself if you won't burn them. That was before the anti-burning mandate. I said, but no, we won't. I obviously don't want to have a problem in your house with kids. Another thing that I remember walking away going, this is something I never heard when I was younger.
Yep, you're right. I mean, we didn't pay attention. I mean, we didn't have the numbers that we're having now. And you expose anybody to enough smoke, I mean, whether they have asthma or not, and they're going to have some issues. But when you have an asthmatic and you expose them to, and again, it's the amount of smoke, it's the time of exposure, it's how closed in it is. I mean, you expose them to enough, they're going to have issues. And then they're stuck having to up their treatments, and kids get to a point they can't get to school, and they can't participate in sports and that kind of thing. So, I mean, sometimes there's exposures that we can't avoid. And we have to just adjust for those. Certain things like if you have environmental allergens and the pollen counts are high, you can't just keep the child in the house the whole time. So sometimes we'll have to step up therapy during the seasons that are bad. I mean, you try and control for the things you can, but there's certain things that you're not going to be able to control for, and at those times you're going to have to step up your therapy during those times of year. Spring and fall are classic,
Doctor, I think we'll be kicked out of the media if we have a doctor on. Don't ask you about COVID at least once.
Is that such a bad thing?
I understand, no. But you're kind of the perfect person to talk to about one of the main disagreements we're having, and that's how much we need to protect our kids from COVID, and it's a pulmonary disease. You've talked about viral wheezing a lot already on the show. As a pediatric lung guy yourself, how dangerous is COVID for kids right now?
Well, I tell you, any virus is going to cause a problem for kids. But it's what we have been seeing in this population is they aren't getting sick like the adults are getting sick. It's not that they're not getting COVID. I mean, kids are getting COVID, and we're testing for it all the time. But you're not seeing the rate of hospitalizations like you're seeing in the adult population. And I think what was really interesting is over this past year, what we've seen happen is that because everybody's been isolated so much, we saw a significant drop-off in the non-COVID viral infections that we normally see every year. Every year we see spikes throughout, especially when the kids start back in school. We see spikes in the non-COVID viral infections that cause flare-ups with breathing problems. We didn't see that all last year. And people are amazed when they ask me, but that was the slowest I've ever been in the whole time I've been practicing over this past year. And most of the COVID patients that I've had that have been coming with COVID have had mild symptoms. And the need for hospitalization is significantly lower in this population compared to the adult population. So I'm not saying they're not getting it. And you do see occasional kids that have inflammatory issues and some kids that will have long-term issues with shortness of breath and that kind of thing, but not like what you see in the adult population. So from our standpoint, we're just not seeing the seriousness of the illness that the adult people are seeing.
Good. And maybe parents breathe a little sigh of relief upon hearing some of that. Dr. Shoberg, we know you've got a busy schedule. Before we let you go, is there anything that you wish we had asked you that we had not?
No, I think you covered the bases pretty well. I mean, I think, the other thing that we see a lot of that we didn't talk about is premature kids. We see a lot of premature kids with breathing problems, and they have ongoing issues. But the good thing about them is they usually improve with time. But again, that's another whole other issue we could talk on.
Well,
we would come back.
Yeah, we would love to have you come back.
Right.
Absolutely love to have you come back. Dr. David Shoberg, thanks a lot for your time and your expertise. Hope you have a great rest of your day.
Great, guys. Good luck to you.